What are you going to study today? Look at the picture and make your guess. Okay, you're right. We are going to study about heart attack in this lesson. So we will cover risk factors of heart attack, the symptoms of heart attack, diagnosis of heart attack, and prevention of heart attack. First of all, what is a heart attack? Now we can see in the picture that the heart itself is a muscle. It also needs oxygen. It also needs blood supply. And the blood is supplied by the tiny blood vessels which are called coronary artery, which you can see in this diagram that surrounds the heart. The coronary arteries are very thin arteries, and if something to block those arteries, do you think the heart will get its blood and oxygen? No. In absence of oxygen, the muscles of heart starts to die, and that makes our heart weak, and this condition is known as heart attack. So a heart attack or myocardial infarction, it occurs when blood flow to the heart is blocked, leading to damage or death of heart muscle tissues. And the most common causes, as I have already told you, is the coronary artery disease or a blood clot. Now you can see this is the coronary artery. Now let's talk about the risk factors of heart attack. Risk factors means those factors that increases the chances of having heart attack in a person. So before going through the what are the risk factors, we'll go through the types of risk factors. There are basically two different categories of risk factors. The first one is modifiable risk factors, which we can modify or we can control, and the second one being the non-modifiable risk factors, which we cannot control or we cannot modify. Now dear students, now we will talk about non-modifiable risk factors. The first one is the age. As we age, the risk of getting a heart attack increases, but we cannot control age, can we? No. The second risk factor is gender. Usually men are at higher risk than women until women reach menopause. After menopause, women also has the same rate of heart attack, same chances of getting a heart attack as the men. And the third risk factor is family history. Some kinds of genes are also responsible for getting a heart attack, and that's why in our family history, if someone has heart attack, that means the gene that is causing the heart attack, the gene that increases the chances of heart attack, is present in our family member. That gene might be with us as well, so that increases the chances of getting heart attack in us. So the secondly, we will talk about modifiable risk factors, means those risk factors that we can control, that is in our hand. The first one being smoking. Smoking has so many unknown chemicals that can cause increase in our blood pressure, that can cause constriction of blood vessels, and that can cause some damages in our blood vessels, causing to the clot formation. The second one being alcoholism. If we drink too much alcohol, if we are addicted to alcohol, then it can cause blood vessel blockage, because the alcohol is digested by liver, which is converted into fat, and the fat gets deposited into our blood vessels. The third one is high blood pressure. The next one is high cholesterol. Cholesterol is linked with the lipid profile of our blood. Then next one is diabetes. Diabetes also increases the risk of getting a heart attack. And then obesity. Obesity means the excess body weight is known as obesity. And when we have excess weight, most of our weight belongs to the body fat. We gain obesity because of excess consumption of calorie. And next, unhealthy diet. when our diet contains too much lipids and too much sugar, then they usually convert into fat, and the fat gets deposited into our blood vessels, and that's how we get heart attack. That's how the chance of getting heart attack increases. And next, physical inactivity. All the calories are consumed during various activities by our bodies, such as respiration, thinking, and muscle movements. Now, if we are physically inactive, then we do not get to consume most of the calories that are consumed. Okay, we do not get to consume, we do not get to burn up most of the calories that we consume. Okay, so those unburned calories, they get turned into fat, and the fat gets deposited under our skin and inside our blood vessels, and that's how the risk of getting heart attack increases. And the next one is stress. Stress causes our body to release certain hormones, and these hormones are known to constrict our blood vessel, and when the blood vessels constrict, it increases our blood pressure. Let's talk about symptoms of a heart attack. First of all, we'll talk about common symptoms. The first one is the chest pain or discomfort. When we start getting a heart attack, we feel sudden pressure in our chest, and so it feels like someone is squeezing our chest, or our chest is so full that it becomes hard to breathe. And the next one is shortness of breath. When we are getting a heart attack, it feels difficult to breathe for us. And then next symptom is the pain in arms, back, neck, jaw, or stomach. At first time, the heart attack pain in a heart attack might start from our chest, but suddenly it starts to radiate toward our shoulder, and then to our neck, to our jaw, and our hands or arms, and then our back, and even it can travel to our stomach. That's why the pain of heart attack is so confusing, right? The next symptom is nausea, vomiting, or lightheadedness. Because of heart attack, our brain cannot get enough oxygen, and due to lack of oxygen, there are some triggers in our brain that that make us feel like we want to vomit, that make us feel such a discomfort in our stomach. Okay, and that causes the nausea, vomiting, and lightheadedness. And the next one is cold sweat. When we are getting heart attack, we sweat a lot of sweat is produced, and when you try to touch it, it is usually cold, and that's cold sweat. Now let's talk about atypical symptoms which are more common in women. In women, apart from the common symptoms that we have studied previously, they show some different or extra symptoms. One of them is excessive fatigue, and the next one is indigestion like symptoms. Okay, so when women start getting heart attack, the symptoms they uh, experience are more likely to be caused by indigestion or gastritis, and that's how it becomes so dangerous, because people might be thinking that, oh, I'm getting indigestion, I'm getting gastritis, so just have a Diazin and it will be okay. We might think like that, and we'll have Diazin, we'll get rest, but what we might be having could be a heart attack, and over time it gets worse, and by the time we realize it is heart attack, it might already be too late. Okay, that's why in women it is more dangerous when they get heart attack. The next symptom is anxiety. Now once again, the anxiety seems like some mental disorder or psychological problem, or it might be daily life stress, but in actuality they might be having a heart attack. So the next one is nausea, vomiting, or lightheadedness, and fainting. Some women might even faint due to heart attack. Okay, so it is very crucial to know whether a person is having heart attack or not, whether the symptoms the person is showing is because of heart attack or they are because of any other conditions in our body. That's why before we conclude that the person is having a heart attack or not having a heart attack, we need to perform some tests. These tests are known as diagnosis of a heart attack. The first one is electrocardiogram. Normal heart produces a regular pattern of electrical field or electrical field, and that is detected by this electrocardiogram machine. If ECG is regular, then it is normal, but if a person is having heart attack, there are some disturbances in electrocardiogram. The second test is blood test. Our blood usually does not contain troponin protein. Troponin protein is released only when our heart muscles are being ruptured. Okay, so when our blood is tested, if troponin protein is detected in our blood, it definitely means that our heart muscles are being ruptured and we might be having heart attack. But if troponin is not detected in our blood, then we are not having a heart attack. The third one is imaging test. It is called CT angiogram. We'll talk more about this in our next section. In CT angiogram, a photograph, X-ray photography is taken in which the blood vessels are clearly visible. It shows the coronary arteries of heart, and if there are any blockage in the heart, it is visible in this angiogram. Next is the stress test. Normally our heart is able to cope general stress. So to detect whether a person is having heart attack or not, the person is kept on a treadmill with some detectors and some sensors, and when the person is doing exercise on treadmill, the doctor checks for the irregularities in the pattern of heartbeat on a monitor. This is called stress test. Now let's talk about angiography. Here you can see the angiograph, the X-ray photography obtained after performing angiography. In this technology, you can clearly see the blood vessels around the heart, which usually is not visible under normal X-ray. So it is a technology to image blood vessels of heart, and it is a type of fluoroscopy X-ray. That means a special contrast dye is injected into the blood, which is harmless to our body, which is neutral, but which readily is visible under the X-ray. And since the dye is visible in X-ray, it highlights the blood flow, and blood definitely flows within the blood vessels. And that's how it helps to view any problems or blockage or damages in the blood vessels. So angiography is very helpful in detecting heart attack. Now, if you see a person having heart attack, what should you do? Should you just watch? Of course no, because every minute is very important to save a patient who is getting heart attack. Okay, now first step is you should call an ambulance, and to call an ambulance you can dial the number 102, or you can call police control also by dialing 100 if you do not have anyone around you to help you. Okay, and next step 2, until the ambulance arrives, you must check if the patient is breathing or not. If the patient is not breathing, then you have to perform CPR, cardiac pulmonary resuscitation. In cardiac pulmonary resuscitation, need to do compression of chest and giving artificial breath or blowing through the mouth. And the general pattern is you should do 30 times compression and 2 times breath. And again repeat the circle, 30 times compression, 2 times breath. And as soon as the ambulance arrives, you must take the patient to the emergency room of nearby hospital where oxygen mask and life support are available. If the person is not person's heart is beating very faintly, then also we can get help from those life support to regulate the beating of the heart. And the step 4, after reaching the hospital, the doctor should immediately give the patient some blood thinner medicines such as warfarin, aspirin or statin. These blood thinner medicines, they help to dissolve the clot in the blood. If the heart attack is in its very initial stage, then just giving the medicine could save the life of the person. The second one is the coronary angioplasty. For doing coronary angioplasty, we use a catheter that is inserted through an artery in our wrist or in our thigh. Now let's have a look at a catheter. Catheter is somewhat like this. It is made up of neutral plastic. Okay, it has a needle made up of plastic, and it is connected with a long and thin tail, right? The catheter is inserted along the artery, and through the artery the catheter travels toward the heart. And uh, as we have already seen through the angiography which part of coronary artery is blocked, the catheter can easily get to that part of coronary artery. After the catheter inserted, you can see in this diagram, the tip of catheter has a balloon which is inflated upon reaching the narrowed vessel. And when the balloon is inflated, it has a metallic mesh which is called a stent. The stent also inflate along with the balloon. Thereby, the stent is placed in the location, and the catheter is gradually pulled away. And this stent has to keep the blood vessel widen and open, and that eases the blood flow. Now let's talk about prevention of heart attacks. Heart attack is mainly due to our unhealthy life cycle. We get high risk of heart attack because of our unhealthy lifestyle. That's why if we change our lifestyle, if we give up unhealthy lifestyle and embrace the healthy choices, then we can drastically decrease the chances of heart attack. The first one is eat a healthy diet. Our diet should be low in saturated fats, and it should be high in fruits and vegetables. The second one is exercise regularly. At least 150 minutes of moderate activity per week is helpful to prevent fat deposition in our blood vessels. If you can do more than this, that is better. The next one is manage stress. Stress can also constrict our blood vessels and increase our blood pressure, which might lead to heart attack. That is why we must learn to manage our stress through relaxation techniques or therapy or meditation or whatever works for you. Well, playing online games might work for some people. Watching series or watching movies could also help for some people, or going for a hiking or a trekking might help for some people. It is not same for everyone. You should find out what works for yourself. Okay, the next one is quit smoking. You see, smoking is not just a problem for heart attack. It can cause a whole array of health problems. Okay, that's why quitting smoking might be the best decision you take in your life if you do smoke. The next one is medical intervention. We must monitor and control our blood pressure, cholesterol and diabetes, because these are one of the risk factors of heart attack. And if we are taking some medications, long-term medications, as prescribed by our medical practitioners or doctors, then we must take them as directed. We should never skip our medications. Okay, so that's it. Healthy lifestyle, healthy heart, and happy you. Thank you very